So much going on with reopening phase 4. Let's dive a little deeper into our current numbers when it comes to COVID-19 and where the virus is in our community. So we're joined once again by Dr. Katie Anderson, part of the infectious disease team at SUNY Upstate Medical. Dr. Anderson, thanks for joining us again.
Thanks for having me again.
So as we mentioned, phase 4 starting tomorrow. So let's look at Central New York numbers. That's everybody talks about. We're going by the data, by the numbers. Let's look at the positive infection rate. 7-day rolling average here in Central New York, 1%. Last 3 days, 1.8, 2.3, 1.1. What's it mean to you?
Yeah, I think as we look at all the different types of data we have with COVID, the testing numbers are actually particularly difficult to interpret. So as we change who we're testing, which thankfully we're now able to test more people, we're testing people who have no symptoms, people who thankfully are now able to have elective surgeries. This is a very different group of folks that we're getting tests compared to when we were just testing people who had symptoms a month ago. So I'd say the data are somewhat difficult to interpret as we expand it, comparing now to March, for example. But the data do also underscore an important observation that whether or not the percent is high or low, it's still greater than 0. So the virus is still in our community.
Yeah, so I'm going to go a little bit deeper with you. I mean, we keep hearing numbers are low, numbers are low. We're into phase 4. Some people think when we've gotten to phase 4, we're in the clear. We don't need masks. We can do big group gatherings. That's okay. So is this still a public health threat, or is it, as I've heard some leaders say, just a facilities thing, meaning senior nursing home facilities?
Yeah. So let's start by painting a picture of where our community is relative to the rest of the country or the rest of the world. So right now we've all been seeing in the news about Arizona, Florida, what they're experiencing in terms of this massive increase in the number of cases. Thankfully and cautiously, I would say that in our area, we are seeing somewhat stable transmission, which is, for now, reassuring. And I think there's probably a couple of reasons for that. One, I do believe our community has been, by and large, vigilant in terms of mask wearing, social distancing, hand washing, things like that, most of us. We may also be seeing some benefit of having more interactions outdoors. So in Syracuse, as compared to Arizona, for example, as the weather gets nicer, as we go into summer, we're actually mixing with our friends more in the open air. So I think we're seeing some benefit from that. So in some ways, as we reflect on where we are now compared to where we were in March, we've learned a lot. We know that simple measures can help slow the spread, but we still have every reason to regard this as a very serious public health threat. And that's because if we just look at the facts, is the virus any different than it was in March? It's not. It's the same virus. Are we any different than we were in March? If we look at how many of us have been exposed, we still believe it's only about 5% of us that have been infected with the virus. So we have a long way to go to herd immunity. So in some ways, I would say, I'd say that we are a step back from the level of catastrophe that we were at in March, the level of urgency and the fear, because we know some things can work, but the threat remains.
My guess is then that you might be a little bit concerned when you hear, we're getting emails all the time from our astute viewers. They point out people not wearing masks in places, in stores. Businesses like gyms, we hear all the time, they're open, they shouldn't be. We even did a story yesterday on a youth baseball tournament in Oswego that's going on this weekend, blatantly disregarding the state rules that say those shouldn't happen. Is that concerning to you? Does that mean we could trend in the wrong direction if we don't stay careful?
We absolutely could, and I find it very concerning. I'd say it's to some degree understandable, and I can appreciate why people 4 months in are tired of this, and tired of masks, and tired of distancing, and changing how they live their lives. But I think that we need to continually remind ourselves that we have a social responsibility here. We need to take personal responsibility. We need to embrace the fact that we can't just stop wearing our masks, actually for the foreseeable future, and that it doesn't come down to just what your risk may be. So you may be lucky, and you might be healthy, and you may think that you'll do pretty well if you get COVID. But what if you're infected and you don't know it, and you infect the elderly person next to you at Wegmans, or you infect a young child who can unfortunately get quite sick from COVID? So we need to all take personal responsibility for the health of our community. And I think it also means, so beyond the personal responsibility of mask wearing, for example, and hand washing. But as we go into phase 4, we need to acknowledge that our state and our city cannot possibly come up with what is a safe plan for every gym, for every manufacturing company, for every restaurant, because they're all so different. And so we need to take the social responsibility to look at these businesses. Just because it's open doesn't mean that we necessarily need to be there or that they have a safe plan. So as you consider broadening what you're doing, going into certain establishments, if it doesn't look as though they're doing things safely, you probably should rethink going there.
Last one for you, and I got 100 more, but last one I'm going to be able to allow to be asked. I keep watching this increase in Onondaga County of positive cases in that 19 and under range. Actually, we just had 4 more in our numbers today. Is it worrisome to you, especially as we're getting youth sports going this summer? Okay, for anything more than just low-risk sports, would that number keep creeping up in that under 19 category?
It makes sense to me that as young people are mixing more, that we'll start to see more cases. And in contrast to when this first started, when we were thinking that young people, even young adults, had no concerns with COVID, we do know that there are rare instances now where young, healthy people can get quite sick. But in general, by and large, I would say there are a few rules we can try to think of as we go into the summer. So outdoor interactions are better, outdoor sports would be better, and minimizing the numbers of interactions that you're having would be prudent in terms of trying to minimize the risk.
Dr. Anderson, I appreciate you being here. As like I said, I still have many more questions, and I'm going to invite you back again to try to ask more of those.
Thanks so much.
Okay, thank you. For more on the coronavirus, including a county-by-county breakdown on the number of cases, head to localsyr.com or the News Channel 9 app. Just click on the banners on the homepage.